Hematology. Hematology is the branch of medicine and pathology that deals with the study of blood and blood-related disorders. It encompasses the diagnosis, treatment, and management of various conditions affecting the blood and blood-forming organs, such as the bone marrow, spleen, and lymph nodes. Understanding hematology in detail involves exploring various components of blood, their functions, common disorders, diagnostic methods, and treatment options. Blood components. Blood is composed of several components, including red blood cells, RBCs or erythrocytes, responsible for carrying oxygen from the lungs to various tissues and organs and transporting carbon dioxide back to the lungs for elimination. White blood cells, WBCs or leukocytes, part of the immune system. These cells protect the body against infections and foreign invaders. Platelets, thrombocytes, essential for blood clotting, preventing excessive bleeding when a blood vessel is injured. Plasma, the liquid part of blood that carries blood cells, nutrients, hormones, and waste products throughout the body. Blood disorders. Hematology encompasses a wide range of blood disorders, including but not limited to anemia, a condition where the body lacks enough healthy RBCs or hemoglobin to carry sufficient oxygen to tissues, leading to fatigue, weakness, and other symptoms. Leukemia, a group of cancers that affect the bone marrow and blood, causing abnormal production of immature white blood cells. Lymphoma, a type of cancer that originates in the lymphatic system, which includes lymph nodes, spleen, and other lymphoid tissues. Thrombocytopenia, a disorder characterized by a low platelet count, leading to an increased risk of bleeding. Hemophilia, a genetic disorder that impairs the blood's ability to clot, resulting in prolonged bleeding. Myeloma, a type of cancer that affects plasma cells, leading to the production of abnormal proteins and weakening bones. Diagnostic methods. Hematological disorders are diagnosed using various methods, including blood tests. Complete blood count, CBC, is a routine blood test that provides information about the number and types of blood cells. Bone marrow aspiration and biopsy. These procedures involve taking a sample of bone marrow for examination to evaluate cellularity and diagnose certain conditions. Flow cytometry, a technique used to identify and quantify different types of cells based on their specific surface markers. Coagulation studies, tests such as prothrombin time, PT, and activated partial thromboplastin time, APTT, assess the blood's ability to clot. Treatment options. Treatment for hematological disorders depends on the specific condition and its severity. Common treatment options include blood transfusions, used to treat anemia or other blood-related complications. Chemotherapy, the use of drugs to kill cancer cells or suppress abnormal blood cell production in conditions like leukemia and lymphoma. Stem cell transplant, often used in severe cases of leukemia, lymphoma, and other disorders to replace diseased or damaged bone marrow with healthy stem cells. Immunotherapy, a form of treatment that enhances the body's immune system to fight cancer cells. Medications. Various drugs are used to manage specific blood disorders, such as anticoagulants for thrombosis prevention or iron supplements for anemia. Hematology is a complex and critical field of medicine that plays a significant role in diagnosing and treating various blood-related conditions. It requires expertise and collaboration between hematologists, oncologists, and other healthcare professionals to provide the best possible care for patients.